right, we are checking in with Dr. Hussain of Trinity Health. He's talking about the latest concerns crossing your minds. We're getting more information with a health expert.
Yes, we are. Thank you so much, Erica. Good to see you again, Doctor, after joining us remotely last week. 'Tis the season for the flu. We're doing okay here, but there are some shortages. We've been reporting on Tamiflu shortages, and when I mentioned that to you just a minute ago, you said it's part of a larger problem where we might be seeing some medication shortages.
Yeah, so parents need to be aware, Tim, that there may be shortages related to children's Tylenol or Motrin. Nothing to panic. If you do need one of those medications and it's not available, then my advice is to talk to the pediatrician, because an adult dose can be downgraded to a child's dose, but it requires age and weight consideration. So it's important you talk to your pediatrician, and then that medication would need to be crushed and given in a form where the child will take it, either in ice cream or pudding, because it's not going to taste the same.
No, it's not.
But nothing to panic, though, but something to keep in mind.
Yes, and please don't panic buy stuff out there. Let's not turn this into toilet paper in 2020 all over again. Recently, Emmy-winning actress Kirstie Alley passed away. We found out it was from colon cancer that she only discovered just before her death. How common is that?
Yeah, this is very sad, Tim. It's actually colorectal cancer is the fourth most common cancer in the U.S. Second leading cancer cause of death after lung cancer. This is why the fact that symptoms are very non-specific, and usually folks don't exhibit any symptoms till it's very advanced. This is why screening is so important. By screening, I mean screening colonoscopy. It should start at the age of 45 once every 10 years. So if you are in that age group or in that category, please talk to your primary care doctor so you can get a referral. If you do have if you have a close relative, either a parent or a sibling, who's been diagnosed with colorectal cancer, then it's 10 years prior to that diagnosis, or 45 years of age, whichever comes first.
It used to be 50. Now because they're seeing more and more early incidences of colon cancer too. What other screening methods are there? Now I meant colonoscopy, the gold standard.
Sure. So there's a DNA test that can be done every 3 years. There's also a test that detects blood in stool that can be done annually. The gold standard remains colonoscopy because it's able to detect precancerous lesions, which can be removed before they progress into colorectal cancer full-fledged. So the good news is if it's caught early, the survival rate is really high. It's great. That's why screening is so important.
Absolutely. And let's finish with some relatively good news. Mpox, what used to be known as monkeypox, at least last time I checked about a week and a half ago, we'd gone in Connecticut a significant amount of time without a single new case, even though there's still popping up new cases in states around us. Nothing big, but it looks like we're definitely over the hump with that.
Yes, we've made tremendous progress. It's required, it takes a village to combat something like this. It's a really good story. We will have to keep an eye on cases, but when the public health emergency for Mpox was declared in August, we had hundreds of cases every single day across the country. Now they're down to less than 10. So this is great, but again, like I said, surveillance will continue, but we expect the public health emergency to be lifted.
And it looks like the final tallies for this year for Connecticut might be about 150 cases and no deaths yet, at least that I know of, that have been reported. That is good news too. Lastly, we always are talking about, hey, flu, COVID, RSV. Are hospitals going to get overwhelmed? From the data I'm seeing from the state that gets published, I'm not seeing anything like that yet. Granted, we're still early. What are you seeing?
We're busy, but we're ready to take care of everybody. We're doing a good job in terms of managing our census and managing patients that we can take care of.
Good. So far, so good. Keep yourself healthy, please, folks. And as always, thank you so much for the knowledge, Dr. Hussain. Good to see you again.
Likewise.
Syed Hussain from Trinity Health of New England. Erica, back over to you.
All right, Tim, thanks so much. And thank you, Dr. Syed.